Type 2 diabetes, which was once a disease mainly connected with adults, is now a growing problem among children. Joining us today to talk more about this subject is Lindsay Bailey, a registered dietitian from Akron Children's Hospital who counsels children and their parents with diabetes. Welcome to the program, Lindsay.
Thank you for having me.
So before we get started, I think a big point of confusion for people is the difference between type 1 and type 2 diabetes. Can you share that difference with our audience?
Sure. Type 1 diabetes is also known as insulin-dependent diabetes. Type 1 diabetes is an autoimmune disorder in which the pancreas stops producing insulin. Insulin is a hormone that helps break down or convert the sugar from the food that we eat. So with type 1 diabetes, the main management is through the diet and through medication. Type 2 is a little bit different. It's referred to as insulin resistant. So the body is still producing insulin, however, it's not using the insulin appropriately.
And type 2 is the one that seems to be growing among kids and adult populations, mainly associated with diet?
Correct. So according to the American Diabetes Association, in 2010, approximately 25 million people had diabetes. Just 2 years later, by 2012, that number has gone up to 29 million. At Akron Children's, we see about 1,500 kids with type 1 and about 80 children with type 2.
So does it seem, from your personal experience, to be on the rise in your practice?
Yes, it's growing. We are definitely seeing multiple kids, and we're pretty busy.
Are they children that are generally overweight that have type 2 diabetes? Is that a common thread?
At times, weight can be a risk factor for type 2. However, it is not the only causation of type 2 diabetes. Lifestyle and genetic factors and family factors also play a role.
So in working with kids and parents, what is the biggest mistake parents are making with their children in regards to diabetes and diet in general?
Mm-hmm. It's important to know that, unfortunately, type 1 cannot be prevented. Type 1 has some genetic components, but there's some unknown factors on what it is caused by. But with type 2 diabetes, there are some family factors and some lifestyle factors in which we can prevent. So typically, we recommend starting up some healthy habits and some healthy eating habits with the children, typically generating some portion control at home and eliminating some sugary beverages at home.
You know, I think that in my experience as a dietitian, dealing with adults, it's very difficult to get them to learn how to carb count and eat correctly so that they feel good when they have diabetes. How do you teach that to kids?
Carb counting is a very difficult technique to teach. First of all, as adults and as children, most of us don't think too much about the food we eat, and now we're asking families and kids to think about every single type of food that they're putting in their mouth. Step one in carb counting is identifying which types of foods contain carbohydrates. And in the American diet, most foods do contain carbohydrates. I have some examples here of carbohydrate-containing foods in the American diet. Carbohydrates such as grains and starches like macaroni, bread, cereal, pasta, some very big kid foods as well as adult foods contain carbohydrates. Any fruits that a child or an adult eats contain carbohydrates. Any vegetables that a child or an adult eats contains carbohydrates. Milk and dairy products such as milk or yogurt contain carbohydrates. So if we're looking at a plate and we're thinking about the meals we eat, almost everything on the plate contains carbohydrates. So identifying carb foods is step one. From there, there's lots of resources that we teach families and kids to use. One source is through the American Diabetes Association. They have a Choose Your Foods list. It is a carb counting tool that goes through almost every single food group and gives us an idea of carbohydrate containing foods, as well as portions, which helps us to be able to figure out, well, how many carbohydrates are in each of these carb-containing foods.
So the parents have to get really familiar with that book. Anytime, especially if their children are new to diabetes, anytime they're eating something, they're probably looking it up.
Absolutely. It's very important to understand the carbohydrates because the medication that they're taking or the insulin they're taking typically follows through with a carb count. Aside from these types of materials, some things that we use very often are things like the Calorie King book because it has lots of restaurants in here. Most of us are on the go, and we are doing multiple meals outside of the home, so maybe not things that are home prepared, but we need to look up the carb count in some of the fast food restaurants or dining outs that we go. We also recommend some apps such as the Calorie King app or the MyFitnessPal app to help assist with carb counting. And most kids and teens and adults have a cell phone with them readily available, and that's an easy tool to help with carb counting.
You know, I think some of the challenges might be that carbohydrates are also in some processed food like chicken. I was serving my kids some chicken breasts, and I didn't do a good job of reading the ingredients list. They loved them, but I noticed there was sugar actually in the breading. Do you have to be that detailed when you have diabetes? Do the parents need to be reading the ingredients list on every product?
Good. It's a very good point. So at times we don't think about maybe the proteins and the meats containing carbohydrates since it is a protein source, but if chicken is breaded, if it is has some kind of a breading on it, like a chicken nugget or a chicken tender, it contains a carbohydrate source. So yes, these are all the little things that tend to add up. Sauces and any sugary containing foods and things that might not necessarily be sweet in taste might also contain carbohydrates. So we teach families to get very familiar with the nutrition facts panel and looking at the label at the total carbohydrates to be familiar with, is there something in this food that can affect blood sugar?
For people that are trying to really control their blood sugar and have been successful at it, do you see that are they eating more whole foods because they just don't want to even worry about what might be in a marinade or a salad dressing or some sort of processed items? Is that a better route to go?
That is typically something that we do recommend. So I get a lot of questions with families asking, are there special foods that I need to be buying for my child with diabetes? Should I be going down the diabetic food aisle? Typically somebody with diabetes doesn't need to buy special foods. So we do recommend just eating normal healthy foods and a balanced diet, and they can still achieve the same blood glucose control through the diet that way.
Let's talk a little bit about the signs and symptoms. I was shocked to read on the CDC website that 8.1 million people in the United States have diabetes and don't know it. What are the signs that parents should be looking for? Because sometimes kids can't say, I don't feel good. What should parents be looking for with their children?
Sure. There are multiple signs and symptoms that a family might be able to pinpoint. One that we see pretty frequently is unexplained weight loss. So if a child or a teen or an adult starts to lose a good amount of weight and can't explain it, that is one. Increase in thirst, so always drinking. Increase in urination, going to the bathroom a lot. Being a little bit moody, feeling a little bit fatigued are also some signs and symptoms.
So are there any new foods on the market that have come out that you really like, that people have been coming in and saying, hey Lindsay, you know, I tried this has helped with my blood sugar control. Is there anything, what's the latest?
So typically we like to stick to foods that have a good amount of fiber in them. Fiber is found in fruits, vegetables, and whole grains. So when we're sticking to foods, those carbohydrate containing foods, they help to regulate blood sugar. So we like to go with those. Also pairing a fiber-rich food like that with a protein source can help to maintain the blood glucose control that we're looking for too.
So it sounds like you can eat almost anything as long as you count your carbs and have a balanced meal.
Yes, essentially. So there's no special product that is really ideal for people with diabetes. We like to stick to normal healthy eating that we'd recommend for the general population.
Now, if you don't get a good control over your blood sugar, what are some of the long-term complications of diabetes?
Yes. So some long-term complications of diabetes can start to affect other organs. So we see things like, this is typically very long-term, but eyesight is affected, some issues with the kidneys, some issues with the heart. So we tend to also focus on food to prevent all of these types of things as well. So eating the low-fat dairy products and the low-fat lean meats kind of help aid the heart. And the general healthy diet kind of helps to prevent some of the long-term complications as well.
So it's good for kids to get a handle on this early because they don't want to so they can avoid or maybe slow down the progression of some of the long-term results of diabetes.
Absolutely.
So how can our viewers reach you if they'd like more information?
Sure. Well, I am at Akron Children's in the Center for Diabetes and Endocrinology. My contact information is at 330-543-6093.
And you'll also be at our event on August 22nd.
Yes, I will be at the Kids Eat Right event. I will be at a table and have some information regarding diabetes.
Thank you so much for joining us, Lindsay.
Thank you.
And if you would like more information about the Kids Eat Right Day, go to our website at www.eatrightakron.org. We'll be right back with more Mind, Body, and Spirit.